Thank you, Marta and Bijon, for organizing this webinar. I really enjoyed Justin's talk as well, because I think it's very complementary to my talk, and I hope that we get to hear Bart afterwards. But if we don't, I think with those two talks, we get a very broad coverage, if I may, of what can be done with metabolomics at the moment. So you heard about the untargeted approach and how having powerful, clever tools to analyze the data, you can really get closer to understanding the data and making meaningful use of it. And of course, since I work at biocrates, I'm going to discuss more what can be done on the targeted side of things, with the objective to basically unleash the impact of metabolomics. And I think if you work with any omic, you might also get that feeling that metabolomics is one omic that still needs to be understood by many people. And I think one of the reasons is that we don't always get to the very depth of what can be done with it. I think as users of metabolomics, we know that it's a very powerful omic, but we need still more examples of impactful uses of this method. So if you know me at all, and if you've ever seen one of my presentations in the last couple of years, you probably know I'm going to be talking about the story principle. This is a framework and a book that I published last year to support people to interpret metabolomic data. Today, I'm going to look at this, and as we go through the 5 steps of this principle, I'm going to show you an example of how this can be used to find a new set of biomarkers for a specific application. And at the end, we will look at some other ways that metabolomics can bring impact to your research, and then finish with a little conclusion. Very quickly, for those of you who have not heard of the story principle previously, I will introduce it, and then we'll go through those 5 steps together. So the story principle is a book, but it's also a framework for biological data interpretation. And the point is to make sense of metabolomics using 5 steps that correspond to the 5 letters of the word story. The book is full of tips and tricks on how to do this work. And I'm happy also and proud to say that it's a community-oriented project. A lot of the information, especially in the second part of the book, comes from discussions I've had with members of the metabolomics community, through my podcast especially, who've contributed their experience on how to do that work and how to work through the data to get the juicy, impactful aspect of the data. And it's also been reviewed by members of the community, and now it's out in the world and available on our web shop, so that you can learn from my experience and the experience of others on how to do this work. So the reading audience for this book is 2 people I have in mind: the curious and the overwhelmed. So the curious are people who would be new to the metabolomics field, either because they're early career scientists or because they're experienced scientists, but who are starting with metabolomics. So it gives you an overview of what metabolomics is and how to best plan a metabolomic project so that you get the most out of it at the end. And this is also something that Justin mentioned a couple of times in his talk. The better prepared you are, the better you plan your study, the best outcome you get at the end. And this is true for every scientific experiment, but it's especially true with metabolomics, because there are lots of factors that can interfere in the profile that you get at the end. So the more you understand your system and the question that you're trying to answer, the better the data you have at the end and the better results you get. I also want to encourage the overwhelmed, the people who are deep in the data and who are a bit challenged. And this can be because you use metabolomics or metabolomics with other omics, and there's a lot of information and you get a bit confused. And so this is also the kind of people that I hope to support with this book. And so I will walk you through the 5 steps quickly, and then we'll look at a detailed example right after this. But for those of you who don't know the story principles, as I said, it's 5 steps, and each step has one of the letters of the word story. You see them at the top here. And the 1st and 4th steps are very important. They're checkpoints. The first one is the one where you plan your study. So you plan what you want to do, what kind of data you want to generate, how you want to analyze it, and most importantly, what question do you want to answer? And this was also something that was driving the examples that Justin presented in the previous talk. What is the research question that you want to answer? This is crucial. We are often presented with omics as a hypothesis-free type of tool, so you can just ask anything of it. But this is not true for any omic, and it's especially not true for metabolomics. Of course, you can use this in a hypothesis-free setting, but you still need to know what you're looking for. You need to choose which samples you're going to put in that study, which groups you're going to compare. So you need to plan which samples you're going to measure. And for that, you need to sit down and really think about what you want to do and kind of imagine and plan the best way to do it. It's not going to be exactly what you imagined, but you want to see at least that the chips fall into place when you imagine the story, and then when things get in your way and it's not exactly as you planned, you can then see what's the best course of action. This first step, safety check, is really for me the most important one, because from that everything else depends. And the second checkpoint is the reality check, and that's when you look at the result of the two intermediary steps. So tidy up your data and operate your tools. This is an iterative process where you're going to prepare your data and then run your bioinformatics tools, and there's going to be some tweaking. There's always some tweaking here. It's normal. And at the end, you're going to have a set of results that you can imagine would be, for example, the figures of your paper if you're writing a paper out of your experiment. And in the reality check, you're going to check, first of all, if you've actually done what you've said you would do in the first step, and if you've answered or at least done your best to answer the question that you wanted to answer. And once your answers to this are yes, this step is also here to tell you that it's okay, now you can stop crunching the numbers, you have what you need. And this is something that really happens often in omic analysis. There's so much information, there's so much more you could do that you're tempted to just go on and not stop. And this is a very dangerous thing. This is what the second checkpoint is here. And once you pass this checkpoint, you can be sure of your data. You can trust that you've done the best that you could to answer this specific question, and then use this static form of your data now to be more creative and to create the story to answer your original question with the results that you have. So this is a much more creative step that relies on the robustness of the analysis that happened in the first steps. So let's look at these steps one by one. And for each step, I'm going to give you the overview, like the generic overview, and then we'll look at an example in the case of someone who wants to build a signature for biomarker for each one of those steps. So first is safety check. It's our first checkpoint. And here we're going to look at the feasibility of the study plan based on 3 levels. So the research question, the data that we have to answer that question, and the bioinformatics tools that we want to run. It's really, as I said, crucial to know what your question is. And one data set might have the potential to answer several questions. That is fine. But these might be just several projects that you will run either in parallel or one after the other. But you should really focus on answering one question with a set of data and a set of tools, because for each question, you might need different sample sets, you might need different bioinformatics tools. So this is a good way to not get confused with the work you have to do and to get each part of the process done from beginning to end. And so I always put in the book also, for each chapter, there's a set of quotes that I put at the beginning of each step. So here, this one by Blaise Pascal is that basically all our miseries derive from not being able to sit in a quiet room alone. And in this case, it's really true. So if you don't plan this well ahead, the most likely thing is that either you're going to get lost in the detail, you're going to lose motivation, or you're going to have to start from scratch again. These are all things that can be easily avoided if you sit down and think about this for a while and then make your plan, and then you can start working. And later on, check that you've done what you said you would do. And so, as I mentioned, the example I'm taking here is of someone who wants to have a set of biomarkers, metabolic biomarkers, that, for example, they might want in the future to qualify as an IVD product or an LDT. So IVD is in vitro diagnostics. I'm not talking now of metabolomics that is already used as in vitro diagnostics, but as more exploratory metabolomics that can be used to find the signature that will later on be qualified as an in vitro diagnostic procedure. And so here, why am I mentioning this is because in my safety check, I'm going to think, what is my research question? My research question is, I want to have a set of metabolites that have the potential to be transferred into an IVD product. That means that they can be translated into this kind of application. So they have to be robustly found in the matrix I'm interested in. I have to have good internal standards for them, like all sorts of things that might not be relevant in my initial more exploratory study. But if the set of biomarkers I find at the end cannot be translated into this specific application that is my end goal, in the end, what I've done in the beginning is not worth a lot, because I will never manage to answer my end question. So this is why here I'm taking a typical example of a standardized metabolomic approach to answer this question. And so in this case, I would, for example, use one of our MXP 500 series kits. So that's a targeted kit with a broad panel. And these kits are validated according to FDA and EMA guidelines. So this is just an example of where I use a certain way of generating the data that will combine with a certain set of tools to answer this specific question. The kit contains the plate and the reagents and also the software to process the spectra. So I have everything in there. So I start to know already the tools that I will use to do this work. And at the end of the day, I will have the absolute quantification for over 1,000 metabolites if I take the broadest panels. And this is beginning to shape what my data will look like. In addition to that, the software, for example, also provides MetaboIndicator, which calculates sums and ratios of metabolites that can give me additional information on what may be happening in my sample. And so additional clinical insights that I can quickly look up in the literature that is provided with it. And so with this, I would have an additional up to 400 plus indicators that would add to my data points that I can use together or separately from the absolute quantification of the metabolites. So I'm starting to see the shape of my data. That is something up to 1,400 biomarker candidates that will then go through the pipeline of all the statistical analysis and so on that can happen then afterwards. And this is going to be the tool parts that in addition to the MetaboIndicator. And another type of tool that I wanted to mention that can be relevant for this specific application is our quantitative metabolomics database. So this is a database that contains reference ranges for the metabolites that are present in the MXP 500 kit. So if I have absolute values of these metabolites and I want to know in a specific subpopulation, so different ethnicities or different age ranges or BMIs and so on, I can check in different parts of the population if there are changes in these metabolite levels and if my set of candidates biomarkers are going to be relevant to all, or if they are most probably going to be only relevant to a subpart of the population. So this helps me also to select which ones might make it to the next stage. And so you see here, it's just ideas, it's just a plan, but this is what you do in safety check. You take all the tools you have. So to this, I would add a layer of statistical analysis that is not represented here. With those tools together, you go towards answering your research question. And there's another aspect that here I would need is the possibility to scale up. So this is also a reason to choose one of those standardized kits, is that if I have a set of metabolites that comes out of this, then I can do a scaling up to measure in large numbers and in large sample volumes by using metabolites that can already be standardized in that way. And so once you have your plan for the first step, then you go to the second step, that is tidying up your data. So you're going to check for sample quality. There are some samples that might fall out because they're simply low quality. The samples have to be relevant to the study design. There are all sorts of things that you're going to look at. You're going to look for the completeness of the data set. So hunting for missing values, both in the data itself and in the metadata. If there's specific metadata you need, then you're going to have to either complete the data set or sometimes remove samples based on that. So you're basically going to clean and tidy your data set, which in the end is a matter of consistency. And so this is ungrateful work, like really tedious and not fun work, but it's really necessary to have high quality data to go into the next step. And one aspect of standardization that is really important is in the processing of the spectra. This is why we provide a software together with our kits. And one aspect that I want to highlight here is the peak picking and the quantification that comes out of the peak picking. So of course we do targeted metabolomics here, but still you have to find the right peak and you have to integrate the right part of the chromatogram, and this is going to be the basis for your quantification. So the more we can standardize this, also the more we can standardize the whole method. And so this is why we worked on an algorithm for automated peak picking that I won't get into detail today, but if you are at the Metabolomics conference next week in Osaka, I will have a talk on Wednesday morning in session 14, where I will describe in more detail how we built this algorithm and how it's used in our software. So this is in the machine learning session next week. And once you've prepared your data set, you can operate your tools. So I'm not going to go in detail into the tools because there's a plethora of tools that can be used. But I basically divide this space of bioinformatic tools for metabolomics into 3 subspaces: so the data-driven, the biology-driven, and the chemistry-driven tools. And some are exclusively in one category, some overlap. For example, MetaboIndicator is very biology-driven because it's based on what's available in the literature, so what has already been described in a biological context. But it's also a little bit data-driven. And there are tools like MetaboAnalyst that cover a lot of ground and that are really useful to analyze your data. And if you have lipidomics, for example, Biopan can be a very interesting tool to group lipids together and understand a bit better what's going on, even though you still lose a bit of the resolution of the detail of the structure of the lipids at this stage. But hopefully this will be more detailed in the near future. And so to go back to the tools I discussed in the initial plan, so MetaboIndicator, again, is these sums and ratios that's incorporated already in the WebIDQ software. So when you buy the kit, you can run that automatically before you export your data. And so every metabolite that has been quantified that is present in your sample, if it's part of a MetaboIndicator of a sum or ratio where the other metabolites are also available, then the formula is calculated, and then you get the results together with your metabolite concentrations. And I like a lot, for example, the one in orange here on the bottom right. So the sum of secondary bile acids divided by the sum of primary bile acids. This is one that we discussed at length in a white paper we published last year on liver disease, Alzheimer's disease, cancer, autoimmune diseases. So it's discussed in many contexts, and it's a sign of an imbalance in the gut microbiome, and it's something that associates with a lot of chronic diseases. So when you see this changed in your experiment, you can say, okay, there might be something going on that is linked to this, and start thinking of how these things link together. So it helps you to build your story about your own experiment. The QMDV is something that many of you may not know because we only launched this last year, I think. But it's a quantitative database where we store data for healthy individuals and for their levels of plasma metabolites. So it's human plasma exclusively at the moment. But for people who are interested in comparing their absolute values to a reference range, this is a very useful tool. At the moment, it contains about 2,500 samples from healthy donors, from healthy, subjects that were contributed by people who use our kits. You can compare and build your own subsets of the population to fit exactly your experiment, and then compare your results to what is in this database. And we're working to grow this database. So if you have an XP-Quant 500 or Excel or P180 data and you want to contribute the healthy controls to this database, get in touch with us, because we're looking to grow this so that it's as useful as possible for the users of this tool. Once you have this, you get to your reality check. So that's step 4, where you compare what you have with the plan that you made originally. So here we had this plan. This was what we had in safety check. And so we would compare the results we have, which would basically be a signature of biomarkers after applying all the statistics that I didn't discuss, because this is not part of a specific approach that you have. It really depends on the topic that you're looking at. But then you see and compare, like, is this getting me closer to answering my question? In this case, do I have enough information that I can think of building a signature based on the results of this work? And so you connect the dots if you say yes, of course. So the last step is you connect the dots and you start telling your story. So you compare to the literature, because you also want to see what other people have found in terms of signatures for the disease you're interested in. And you're going to build your story, discuss it with others, and also in the case of a biomarker study, you're going to have to build your own product and make a validation study, which is a lot of work, but the discussion around this is also part of building the story for it. And I want to point you to 2 examples. One that I discussed in the podcast last month with Sabine Ban from the Cambridge University. We discussed with her the study that her group did on markers of bipolar and unipolar depression. So that's bipolar disorder and what we commonly call depression. To look for a signature to discriminate between those 2 conditions, so that people get better diagnosis and also more adequate treatment. So her group found a set of small molecules and lipids that could discriminate between the two groups, and they're working now based on that to build an IVD product that they want to develop in the future. So they're working on validation studies and so on. And so if you want to hear more about this, I encourage you to go to the metabolomics.com, and there you can find the podcast episodes where I discuss this with Sabine Bahn. Another example is from last year from a group in Germany that used this kit to screen the serum of patients with pancreatic cancer that received chemotherapy. And parts of the cohort responded to the treatment and another part didn't. And one analyte that they found was different between the responders and non-responders was a derivative of tryptophan called 3-indole acetic acid. And they went on after this, so they did like a basic profiling to understand what's going on. And then based on that, they designed the next studies where they used an animal model to see if the microbiome of the responders and non-responders could contribute to the response of the mice. And they found that supplementing, especially supplementing with 3-IAA in the non-responders could make them have a response to chemotherapy. So they're working now to see if this approach can be used also in patients. But this is also a good example to see, like with a very specific question, you can design your study from beginning to end and then end up having very powerful and impactful new approaches to your question. And so these are some of the many ways that metabolomics brings impact to your research. I want to very quickly point to our white paper from last year where we discussed the impact on health of what we eat and of our microbiome and the metabolites that come out of those two streams. You can find this white paper on complex chronic diseases on our website. I won't go into too much detail because I'm already over time. We also updated our microbiome page on the biocrates website with a lot of information on how metabolomics together with microbiome research drives innovative therapeutics. So I encourage you to check out this page as well. There are examples of preventive, predictive, personalized, or even participatory medicine based on the combination of metabolomics and microbiome. And so in the end, the idea is you can be translational by design. So if your goal is to translate into the clinics, for example, even if you don't start with a product that is IVD, you can still begin with certain technologies that help you to get there faster, where you know that the results will be easily translatable then in the clinical setting. And so in conclusion, plan your next project with impact as your goal, whatever it is. Of course, you might not be working in biomedicine, you might be working in other fields, but the story principle really applies to any use that is made of metabolomics. So plan ahead, establish what are your requirements for your study. They might not be what I think is important, it can just be what you know is important, and choose the tools that guarantee your impact down the line. Also, and this goes together with what Justin was saying, talk with other people, exchange with other people, and stay curious about what is happening in the community. I think it's really nice that we get these different perspectives so that we can all learn together about what's going on, what others are doing, and then get the best out of all worlds and then use that in our research and share your ideas with the world, because this is how we all get to make the field more impactful and more relevant for everyone. So this is an overview of all the ways that we support data interpretation at biocrates. One thing I haven't mentioned is our data interpretation services. And very soon we're going to start supporting customers with multi-omics analysis as a service. So if you want to combine your biocrates metabolomics with things like epigenomics or RNA sequencing, for example, get in touch with us and we can discuss what is possible. And that's the end of my talk. So I'm happy to take questions.